Hello, my name is Danielle and welcome to my presentation on the placebo effect on upper and lower body muscular strength and endurance. The use of anabolic steroids and ergogenic aids is widespread in sport and exercise settings around the world. With drive to reach optimum athletic performance high, athletes are continually striving to enhance performance in a number of different ways. Intensity, density, frequency, and nutrition are example training paradigms that are significant features in achieving the full capacities of an athlete. However, the use of unverified or potentially dangerous supplements is continuing to emerge. It becomes apparent that the use of anabolic steroids could be curtailed by developing one's mental skills and convincing athletes to use the power of the mind alone. Placebo can be defined as the treatment or substance given to any patient or participant that is thought to be ineffective and therefore should not produce any physiological benefits. Increasing in the placebo group is often observed together with effects on the experimental group and is known as the placebo effect. In comparison to its use and performance in medical science, the true scale of the placebo effect on sports performance has only recently been researched in the field of exercise and sports psychology. Such research is centered around the deceptive administration of performance-enhancing supplements, which include steroids, sodium bicarbonate, caffeine, and superoxygenated water. The motivation of various studies conducted and the idea that the power of the mind alone has an enormous effect on influencing physical performance measures was initially reported in the field of sports and exercise science by Ariel and Seville. A study was conducted to investigate the psychological benefits of an anabolic steroid placebo and consisted of the administration of placebo pills to 6 out of 15 male varsity athletic subjects. Through the analysis of performance measures, it was found that, upon consumption of the placebo, strength gains registered above and beyond expected reasonable progression. Since then, the placebo effect has been the focus of various studies conducted with an overwhelming amount of evidence supporting the premise that performance can be enhanced through the power of the mind. This is particularly shown in research pertaining to the lower body musculature, with a lack of literature confirming the positive effects of upper body endurance and the placebo effect. An example study was conducted by Duncans, Lyons, and Hankey, who investigated the placebo effects on caffeine on short-term resistance exercise to failure. They discovered that the positive belief of taking or using a performance-enhancing aid was enough to enhance performance. Given the paucity of research confirming the positive effects of upper body endurance and the placebo effect, the purpose of this study is to investigate the influence both negative and positive suggestions have on the performance outcomes, and to explore the influence of ergogenic aids in the performance of upper and lower body skeletal muscle strength and endurance exercises. Based on the findings of aforementioned literature, it is hypothesized that upon consumption of a placebo, there will be an increase in the performance measures of both 1RM bench press and squat exercises when compared to baseline and T1. This is a direct result of participants believing they have consumed a performance-enhancing supplement that increases muscle strength and endurance by 10 to 15%. Furthermore, upon removal of placebo and disclosure that the amino acid supplement will not enhance performance, 1RM measures will decrease and return to baseline. A within-subject design was utilised to investigate the placebo effect on upper and lower body muscle strength and endurance in a group of 15 apparently healthy college-age men. Subjects were informed as to the experimental procedures and signed informed consent statements and medical history forms in adherence with the National Ethics Statements approval by Central Queensland University prior to any data collection. Before participation, subjects had to A. Sign statements they had currently been performing upper and lower body strength training for at least 3 days per week for the last 6 months prior to the start of investigation, B. Had not consumed an ergogenic aid for at least 4 months, and C. Agreed to refrain from resistance exercise from the duration of the investigation. In an attempt to minimise the learning effect, participants were familiarised with each of the testing procedures. 1 repetition 1 repetition maximum bench press and 1 repetition squat, as well as maximum repetitions of 80% of their 1 RM max for bench press and squat exercises. Following familiarization, baseline testing was performed prior to the testing sessions. The 15 participants were put through familiarization, baseline, trial 1 and trial 2 days. Familiarization day ensured that the subjects were able to perform the tasks required by having a practice go at the strength and endurance exercises. 4 days after, participants came back and anthropometric measurements were collected. Subjects then completed 1 RM and muscular endurance tests for both bench press and squat exercises using identical procedures to those performed during familiarization testing. The food diary and placebo was administered, and participants were told that the placebo does work. The subjects consumed the supplements 3 times a day for a period of 4 days prior to testing 1. 4 days later, the participants returned for T1 and carried out the same 4 strength and endurance tests using the identical procedures to those performed during baseline testing. Subjects were then told that, based on recent university findings, the supplement does not work. However, they needed to continue consumption of the supplement 3 times per day. They returned 4 days later for testing session 2 and completed the same 4 strength and endurance tests following the previous protocols. A 2-factor ANOVA without replication analysis was performed for 1 RM bench press and squat, as well as the maximum repetition of 80% of 1 RM bench press and 1 RM squat across the 3 conditions of baseline, trial 1 and trial 2, with an alpha level set to 0.05. Statistics were conducted by Microsoft Excel 2000 with analysis toolpack, and post-hoc paired sample t-tests were carried out if a significant difference was observed in the initial ANOVA testing. A 2-factor ANOVA without replication was also applied to total kilocalories, protein, fat and carbohydrates consumed between testing sessions to determine possible variance in nutritional intake. The performance measures are in kilograms for the 1 RM squat and bench press, and the 80% repetitions of how many times they were able to lift the weight. Analysis of the data detailed that a significant difference occurred between baseline and trial 1 for squats, as well as baseline and trial 2. There were no significant differences between trial 1 and trial 2 for squats based on the 1 RM results. Additionally, significant differences were found between baseline and trial 1 for maximum repetitions at 80% of 1 RM between baseline and trial 1 and trial 2. No significant difference occurred between baseline and trial 2. Results for bench press yielded some significant differences across trials, although these did not replicate the significant difference patterns found in analysis of the squat data. Significant differences occurred in the 1 RM bench press between baseline and trial 1 only. No other significant differences were found in the bench press data between trials in either 1 RM or 80% maximum repetitions. Mean and standard deviation for all conditions can be found in Figure 2. Analysis of nutritional data detailed that no significant differences in participant nutrition consumption across all trials was evident. This is detailed in Figure 2 and Figure 3, which you can see on the screen now. Significant differences were found between baseline and trial 1 for both bench press and squats in relation to 1 RM when participants believed they had consumed a performance-enhancing amino acid. Endurance levels increased at the significant level solely for squats. These results supported the literature from a number of different studies, whereby placebo was found to improve performance. Interestingly, squat and bench press data post-placebo yielded contradictory results. The significant improvement observed for squats remained in T2 for both 1RM and endurance measures. Bench press data in T2 confirmed no significant difference from baseline and demonstrated an observed return to pre-placebo improvements. Given these results, the hypothesis was supported by both measures. This is due by the fact that squat performance improved in both strength and endurance and with the placebo in place. Bench press results were supportive in relation to strength only, as endurance levels failed to improve significantly. In explaining the observed differences pre- and post-placebo for squats, it is possible that the improvement to performance remained as a result of self-efficacy and familiarity with the movement. Simply stated, once participants knew they could lift a heavier weight and for more repetitions, they knew they had the muscle capacity and mental fortitude to repeat the previous performance. I did it before, therefore I can do it again, is what they could have thought. This is supported by Bandura's self-efficacy explanation. Also, Housen and Martin reported that lies through placebos have been used by credentialed professionals throughout the history, and the belief in oneself plays a powerful role in the ability to be able to replicate or increase participants' performances. It is also possible that participants did not follow the procedures set forward by administrators and did not work maximally as required during baseline testing. As a result, an accurate 1am was not recorded for the baseline, which in turn showed a higher level of improvement for both T1 and T2 during strength and endurance testing for squats. It is possible that a motivational tool could have been employed during baseline testing to ensure maximum performance, as was seen in Ariel and Seville in 1972. The results of the current study support the belief that consumption of an ergogenic aid can improve strength, which resulted in increased performance in both squat and bench press 1RM results. Squat and bench pressed 1RM results. Endurance improvement was observed in squat performance only. This supports a number of studies and highlights the benefits of positive self-efficacy, even if it is achieved by artificial means. Future research on how to maintain both positive self-efficacy and physical performance improvements post-placebo would be beneficial to athletes and coaches alike. Alternatively, research on the impacts of positive reinforcement and its impact on performance may be preferred. This is due to the fact that it eliminates the need for placebo and avoids deceptions and the breakdown of trust. Thank you for listening. By references.